Thank you for joining us. I'm Sandy Middleton, Executive Director for the Center for Violence Prevention, and today is Human Trafficking Awareness Day 2021. And we wanted to do this today, and we've got some wonderful experts and people who've had a lot of experience working with victims of human trafficking joining us today for this Zoom meeting. Let me just quickly tell you who everybody is. We've got Christina McCool, who is our operations manager for the tower. Christina also manages our rapid response throughout the state. We have Beth McCord, who is our nurse practitioner at the bridge. Beth is a key partner when it comes to forensic care for victims. And we also have investigator Philip Hendricks with the Attorney General's office. Philip comes to us with a wealth of experience. He was task force investigator down in the Pine Belt, and we're thrilled to have Philip join with us today. I also want to introduce our interviewer, Sarah Fullen, who is the Executive Director for Mississippians Against Human Trafficking. That's our coalition that's going to be working to help raise awareness across our state. So welcome to everybody. I see a lot of friendly faces out there, and it's our privilege and we're to be here with you today, and we're grateful for every one of you taking your time on this snowy day to join us. So Sarah, you can take it from here.
Well, thank you, Sandy, so much for letting the coalition be involved and just all the work that you and your team are doing on the ground throughout the state, making a difference for our human trafficking victims. So we've got a couple of questions we're going to ask our panelists today, just kind of going over human trafficking and some of the things that they see to bring a little bit of awareness for individuals who want to know a little bit more. And we'll just start off with the basics. Philip, we'll go with you. Can you talk to us a little bit about what human trafficking is and kind of what types of trafficking exist out there?
Um, if you would think of one word to summarize human trafficking, it would really be slavery. A lot of these people, they don't have any self-determination. They're completely controlled by their trafficker. The two types of trafficking are labor and sex trafficking. A lot of the labor trafficking starts with human smuggling, people brought into this country from somewhere else, and then they're told that they owe a debt for the cost or housing them. And a lot of times these people, they don't have their documents, they don't have legal status. So they really feel trapped. And sometimes there's an element of violence involved in that as well, or threats. If they don't work off this debt, something's going to happen to their family members back home. The sex trafficking is it's basically forced prostitution. From a legal standpoint in Mississippi, investigators seek to prove elements of force, fraud, and coercion if the victim is over 18. But these pimps control both men and women with either with drugs, threats of violence, or basically they just break them down, deprive them of all of their sense of self-worth by doing horrible things to them where they feel trapped and feel like they don't have another option.
So a lot of people in the state I know still do not think that Mississippi is a place where human trafficking exists. And obviously we all know that that is not true. Talk to us about what signs typically play out in human trafficking in a state like Mississippi.
Um, anyone who doesn't believe it's here, I'm happy for them that their life affords them the luxury of that naivete, but it's here. If you go to any city of any significant size in Mississippi, all of your low end hotels, you're going to have women and men there who are victims of trafficking. Um, the ads are often on the internet. Traffickers will post pictures of men and women. They'll text with potential buyers and then set up dates. A lot of times they're controlling these men and women with drugs and taking their money from them as well. And also threats of violence. We've seen several women that had injuries or have reported being physically assaulted or controlled with drugs.
I'm going to shoot over to Beth real quick. Beth, talk to us a little bit about what the signs are for someone that's been trafficked in the event that you think you might have run into someone or come across someone that you think might be might be being trafficked?
So from a medical standpoint, what we kind of look for is somebody who presents with frequent pelvic infections like pelvic inflammatory disease, somebody that presents with multiple sexually transmitted infections, miscarriages, or not knowing that they're pregnant. The other part of that we kind of observe is who do they show up with, who's with them, what their interaction between that person is. Do they have their ID with them, or do they have to go to somebody to get it, especially if it's somebody who's an adult? We also look at, do they know where they are? Do they know that they are in Jackson? Working in an emergency room, I have come across a couple of patients where they thought they were in Louisiana, didn't even know they were in Jackson, Mississippi. And so that's something that we look for, not only what their complaint is, their history, but also who they present with.
For going into how people are at risk for being trafficked, I know that it can span across many individuals. Christina, speak to who is most at risk for being trafficked, especially somewhere like Mississippi.
I think we look at what the vulnerabilities are, and typically the more vulnerabilities an individual has, the more likely they are to be at risk for any type of interpersonal violence, but especially sexual exploitation. So youth generally is vulnerable because they don't have the ability to live independently, financially independently anyway. But then a history of trauma, specifically sexual violence, that increases their vulnerability to be exploited. Foster care, drugs in the home, domestic violence in the home, any sort of events in their lives that kind of disrupt the stability. Also, as you get older, homelessness or domestic violence or addiction, anything that kind of destabilizes a person and makes them dependent on others can increase their vulnerability to be trafficked.
So looking at some of those at-risk groups, Sandy, tell us how individuals are typically recruited into sex trafficking.
Well, to piggyback off of what Christina said, these high-risk minors are most likely groomed into the life. We'll see traffickers pretend to be a friend or a boyfriend, and they may offer food or shelter. They may promise a lot of things like an adventurous life or just safety. Studies that NCMEC has done, it reports that 50 to 90% of child sex trafficking victims have been involved in the welfare system as well. And 1 out of 6 of these minors are likely victims of child sex trafficking. So we see a lot of grooming for these high-risk individuals. And, again, as Christina said, the runaway and homeless teens are really at the greatest risk. But any child, any adult can be groomed and can be approached. And unfortunately, nobody is immune from exploitation. And then we also have the whole social media component when it comes to recruiting into sex trafficking. And so many apps exist, dating apps and things that it's so easy to sell sex in today's society. So those are the biggest things that we see.
Christina, we're going to go back to you for a second. How do y'all help with the Center for Violence Prevention? How do you guys help adults who are classified as human trafficking victims?
So we have a pretty unique program. It actually is the only long-term recovery program in the state of Mississippi. It's up to 2 years, but it is a community of trafficking survivors that live together and recover together. And we take evidence-based practices and models that have been supported by research to help these survivors recover emotionally, psychologically, physically, and financially. Because without the financial recovery, they still have an increased vulnerability. So you know, as a community of survivors, they support one another. They're supported by the different types of therapy that we offer, including EMDR and DBT and IFS for those who are in the therapy world. Also animal assisted therapy. You know, it's like I said, for up to 2 years, because this is not a quick process. This is this takes time to recover, not just psychologically and emotionally, but to become financially stable. And basically, when most of them have only themselves and very few family that have stayed connected. So they have to develop community, not just with survivors, but in their addiction recovery, which a lot of them do have, finding new friends and places of employment. All of that takes a substantial amount of time.
Now, I know beds and limitations on that are always an issue, whether that be for Mississippi or other states. Are there other resources in the state that victims can get if they need them?
Well, we have really worked hard to partner with all nonprofits in the state to try to serve the survivors in our state. So right now, we're the only specialized long-term program, but there are other domestic violence shelters that are serving human trafficking victims on an emergency basis. If there are any transitional housing programs in the state, we'll try to plug some survivors in there. But the overall support that they need, it's really difficult to get the resources to them that they need if they are not plugged into you know, a specialized program. But we do work with all the nonprofits that are available.
Now, Sandy, you and your team have worked hard to help adults in Mississippi who have fallen victim to human trafficking. Are there services in the state for children?
There are few, if any, specialized services available to minor victims of human trafficking in our state. Now, our rapid response advocates are in the field every day. They're assigned to the task forces across the state, and they're contacted by law enforcement or many times from CPS to respond with them to provide a trauma-informed response to minor victims. We do not currently house minor victims, but we are involved in helping them upon recovery. And many times, those 5 advocates that are around the state, they have a pretty extensive Rolodex, you know, to offer different types of help to victims. We need much more, but we are, for the first time, thanks to recent legislation in the State House, we are fortunate enough to be able to begin to count these victims and respond together and rapidly screen them and identify them as victims of human trafficking. Unfortunately, for so long, we have branded these children as runaways and bad kids, and we've locked them up in juvenile detention centers, and we put them on the state's merry-go-round. Unfortunately, it's not a happy one when it comes to placements. Everything's about the money, of course. And so when Medicaid is tied to serving these minor victims, they can only stay a very short period of time in these different placements. So they may stay in juvenile detention for 5 days, and then they may get moved to a mental health facility, which is, again, going to be a short time stay. And then you'll see them moved into foster care so many times. And that can be a nightmare if it's not properly managed. Now, we do know that we've got some wonderful foster homes throughout our state, and we've got some wonderful parents who are opening their homes and their arms to love these children who have been so abused and so neglected. And it's important in our recent legislation as well that we are informing adopted parents if they are assigned or if they are given a child who is a victim of trafficking, because it's important that they know how to address this trauma. And it's also important that they continue long-term services. So, and you know, we keep talking about minors, but one of the reasons that the minor intervention is so important is because most of the adult women that we see actually entered into the life of trafficking as a minor themselves.
Beth, we're going to hear from you for just a moment. When treating some of these victims, are they always open to help? Are they always aware that they've been victimized in this situation? Like Sandy just said, you know, a lot of the adults that we see still in human trafficking were brought in as children. Do you ever see people that don't recognize themselves as being a victim of this? Beth, did we lose you?
She's muted.
Okay, let's try that again. So they are not always open to help. And a lot of that is because the system has failed them, whether it was the medical system or law enforcement. Somewhere along the way, they have been promised things and been failed. So they're not always open to help. Many times you have to build that rapport. And when they've tried to have that with somebody that promised them help and then they didn't get it. One particular story that I have is one victim I was called in to respond to provide a medical forensic exam on. And I get there and law enforcement's there. And because law enforcement had a history with this person, seeing them on what was then Backpage, I was not able to fully provide her medical attention. And her story, her child's father was making dates and making her go, and that was how she had to make money for them to live. But this officer had seen her so many times, and so she came for help, and the medical system essentially failed her because they called the police, and nothing really warranted by state law for the police to be called, and the victim didn't want that. And so she was withheld medical attention. And that's just an example of why they're not always open to receiving help. It's because so many times when they go to get it and they just want to be checked out medically, not necessarily trying to get out of the situation and not necessarily wanting to leave because a child was involved in this particular case. And she was failed. She wasn't even able to get medical attention because, you know, somebody took that from her. So they're not always open to getting help. And when you, as a medical professional, try to build that rapport, it is sometimes hard.
What is the role of SANE, or SANE, if I'm saying that incorrectly, in working with human trafficking victims?
So a SANE is a sexual assault nurse examiner. And that is normally a registered nurse who has had at least 40 hours of training in how to take care of a sexual assault victim. And that includes human trafficking victims, and also how to complete a medical forensic exam with evidence collection. And so the role of the SANE taking care of a human trafficking victim is much like that of any sexual assault victim. Is we try to, our goal is to empower them to have control over that exam room, over what happens in that exam room, to make sure that they're aware that they control that area, and to educate them and to make sure that they know what treatment they need, what they can have access to, and make sure they actually get it. Make sure that they have the resources to get medical testing, whether it be for HIV, for syphilis, herpes, hepatitis, and get prophylactic treatment for any of the STIs, to make sure that they know their body and that they know any injuries that they may have, and make sure that they have the resources to get better and to improve their situation.
Now, I know one question that the coalition often gets when we're talking about awareness and about facilities or services for adults and children that have been trafficked is, well, there's homes out there, there's foster homes out there, there's services out there through the state. So why can't we use those? Why can't those people do that? Sandy, can you speak to why a recovery and care program for someone who has been a victim of human trafficking is vastly different from other violent crimes?
Well, yes, Mississippi needs a good, comprehensive, collaborative model when it comes to our human trafficking response. You know, and it's like you said, unfortunately, human trafficking is something that a lot of people are interested in and they want to help. And so they just want to jump in and you really need some specific training and experience in working with this clientele. The Center for Violence Prevention, of course, is our background is victims of interpersonal violence, working with domestic violence and sexual assault victims. And so we started seeing victims of human trafficking about a decade ago. And thanks to some of our federal funders, we're able to attend some really great training across the country, excuse me. And so we started screening in these victims years ago and developed our evidence-based program in 2017. And so it's important that we identify the people who have evidence-based programming and who have appropriately trained personnel to work with these victims if we're going to help. Unfortunately, we've seen cases where victims have been re-exploited through their quote unquote care or the program that they entered, because people just don't know. They want to help, but they really don't understand what it means to be trauma informed and to have evidence-based programming. And so we're looking forward to the partnership with the coalition and with the Attorney General's office to designate programs as certified to be certified long-term programming for adults and also for minors. And it's just really important for people to collaborate. I do want to plug at some point, Philip, I'd love for you to talk about the task forces and the role that the task forces have played across the state in kind of stepping forward to form that collaborative model, because it really takes all of us. It takes a well-trained law enforcement, it takes the forensic piece, it takes the advocates on the ground, and then it takes the emergency shelters. And Christina mentioned that we're partnering with several domestic violence shelters around the state to provide that emergency response. But then we also need the long-term recovery model that victims can find at the tower through the center. Philip, do you mind just jumping in and talking about the task forces?
Be glad to. The kind of the model for the task forces was you would have victims advocates, a sane nurse, then you would also have law enforcement there that would investigate the actual crimes. The way the Pine Belt Task Force typically worked was that everybody received training, and then we would schedule ops where we would actually try to make dates with potential victims by going to these ads on the escort websites, and then we'd have a team there. We'd make contact with them. We would put them in touch with victim services, and then they'd also be interviewed with law enforcement or by law enforcement to see if there was any evidence we could get from about their traffickers. Sometimes the traffickers were on site and were actually arrested. Sometimes they drove them to the dates. And it was a really positive thing. A lot of these people, both men and women, they've been conditioned to believe that law enforcement is only there to put them in jail, that we're going to judge them. And it was, as the task force evolved, it was really great to tell them, look, you're not going to be arrested. We're taking you to meet with some really kind people who are going to tell you about services available to help you get out of this life.
Real quickly, Philip, can you speak to any misconceptions that the task forces or the law side of it run into with human trafficking victims?
I think there's several, but I would say probably the biggest one is that the victims chose the lifestyle that they're in. A lot of I've seen it. People see this person, and what they immediately assume is this person is a drug addict, and they're doing this to support their drug habit. Some of them absolutely did not choose it. We've seen familial sex trafficking where they're actually being prostituted by a parent or a grandparent while they were still a minor. Yes, they generally do develop a severe drug problem, but it's either they're being fed drugs by their trafficker as a means of control, or it's something that they're doing to cope with their horrible life. But I've yet to meet a victim that actually set out and said, this is the life I want for myself. They were all in a vulnerable situation and someone exploited them instead of helping them.
Christina, can you speak quickly to what people should do if they believe that they know someone who has been trafficked?
By far, the best thing to do is to refer the victim or to call the National Human Trafficking Hotline, and that is 888-3737-888. And that is because our state has a really good partnership and network, and those tips go through our state agencies, through our task forces, through, if it's a minor involved, through our CPS system. And it gets broadcasted and sent to the people that can investigate and can provide some intervention. Don't get involved. I don't recommend that anybody themselves, insert themselves in the situation. That may not be safe for the suspected victim, and it certainly may not be safe. All your observances can be reported to that hotline.
And Sandy, we've got just a few
And
minutes.
victims, by the way,
No, go
I just
ahead.
wanted to say victims, by the way, victims can also contact the hotline, and they are networked throughout the country. And so they can get to specialized services that they need through that hotline.
Sandy, can you just quickly mention what would the greatest step be for Mississippi in supporting these victims?
Well, we can't move forward without looking behind us and just expressing all kinds of gratitude for the work that we've been able to do in the Mississippi legislature with the leadership of Speaker Gunn. And we've passed some wonderful legislation and have risen to the top. And we've actually gotten a lot of national attention for our legislation. So we're really proud of that. We're grateful to the Speaker for his long-term support. And as I mentioned earlier, we're excited that we've got a partnership now with AG Fitch, and we appreciate her support in developing all of these response models. And so I think just to continue off of what we had said before, moving forward, we must provide specialized care, funding and care for victims of human trafficking, specifically our children, because as we've already stated, we don't have a long-term program for our children. We have a lot of short-term things, but nothing that's specialized and really gives them the time. Time is crucial to recovery with this complex trauma and everything, all these horrific things that have occurred to these victims. It just takes time to recover. And sometimes that can take up to 2 years. And in reality, it can take a lifetime. So Mississippi is going to have to come to grips with the fact that there's going to have to be some funding. We can't always depend on just the general public or grants. At some point, especially with our children, we've just got to commit some funding through our state to provide what we need to for our children. I think the second thing, and equally as important, is to move forward with our existing task forces. They've proven that they work. It's proven that that collaborative response with law enforcement and advocates and SANES, immediate and expert response really is working. We're getting cases that are coming up through, and I think we're going to start to see more guilty pleas and more trials on these human trafficking cases. So that's equally important when it concerns the existing task forces, and just finally to encourage the collaboration and to engage systems who have experience in working with these victims. The center, again, in partnership with AG's office, is going to be training some advocates to assist in emergency response. And if you want extra information about that, you're welcome to reach out to us afterward.
Well, I just want to thank everybody for being on this panel and allowing for the coalition to be a part of it as well. And for anybody listening, you can find more information on everything that we've talked about on msc4vp.org. That's about the Center for Violence Prevention. And you can also check out more information about the coalition and kind of what our goals are at nomorems.org. We thank everybody for being here, and we're right at 1:30, so I think that that's a good 30-minute wrap. So Sandy, unless anybody has anything else to add, I think that's a wrap.
Thank you. Thank you for joining us.
Thank you. Thank everybody.